Hello comrades, welcome to this presentation. I would like to discuss the management of the third stage of labor. Okay, before I talk about anything here, I want you to understand what we need from you when we ask you to write an essay on how you're going to manage a client in the third stage of labor. What we want is you to talk about what you will be doing when at this stage of labor as a midwife or a nurse. Okay, we don't want you to start talking about the physiology of placenta separation. We're not interested in that. We want you to explain what roles you will be playing as the placenta is separating and descending. Okay, so this is how you are going to write your essay under management of third stage of labor. As it is for all managements of patients, you need to begin with your objectives. Okay, and these are some of the objectives that you can include in this management. The first one, you may say to facilitate the delivery of the placenta. The second objective, to prevent infection. Third objective, to prevent complications. Fourth objective, to prevent postpartum hemorrhage, okay, or excessive bleeding. So there are many more objectives that you may write, but those are the few that I have listed down for you. Then after writing down your objectives, you may talk about psychological care of the patient. This patient must be prepared psychologically, must be made ready for this stage or this process as well. Okay, so under this subheading, you may talk about you encouraging the patient and explaining the whole process to the patient and what they should expect during this stage of delivery. Okay, during this stage of labor, you have to reassure the patient that you are there to do everything possible to make sure that they deliver successfully. Okay, do not panic. Don't show the client that you are panicking. Be calm and make sure that the patient has no anxiety. So you have to manage that anxiousness. Okay, and then after offering the psychological care, you may talk about observations. Okay, you need to take the vital signs as well, the pulse and blood pressure. Very, very important to take these under this third stage of labor, because they will also help you rule out any hypovolemic shock. Okay, apart from taking those vital signs, you may also observe for signs of placenta separation and descent. Okay, if the placenta has descended and if the placenta has separated and it's descending, you may instruct the woman at this stage to apply some maternal effort to facilitate the expulsion of the placenta. Okay, and if that happens, if the placenta is expulsed at this point, you may not need to carry out to actively manage labor because the placenta has come out already. Okay, apart from that, you can also talk about infection prevention. Very important. It's at this stage that the woman is most vulnerable to infections. Okay, so you have to make sure that you prevent infection at this stage as well. What are you supposed to talk about here? Under infection prevention, you may talk about the necessity of you gloving up with sterile gloves and using of sterile equipment like forceps for clamping of the cord, and also the sterile scissors, and making sure you're instructing the woman not to touch their vulva, okay, to prevent infection. And make sure the receiver that you place under the vulva is also sterile. Okay, so that's under infection prevention. Then positioning Positioning is very important as well, depending on which type of management you are going to use. If you are going to actively manage the patient, and if you are going to passively deliver the placenta also, you have to select an appropriate position here. Okay, so if you are going to actively deliver the placenta, you may talk about okay, I would actually encourage you to talk about both here under positioning. Okay, you may say under active management or under active delivery of the placenta, I will encourage the woman to be in the dorsal position for easy delivery of the placenta, because you have to use the CCT, which is a cord controlled traction, and you also have to use to palpate the fundus. Okay, to palpate the uterus on the abdomen. So you may say, with active delivery of the placenta, I will instruct the woman to be in the dorsal position for easy access to the fundus and for easy performance of the cord controlled traction, CCT. And for passive delivery of the placenta, I will encourage the woman to be in the kneeling position. Okay, this kneeling position will facilitate the delivery of the placenta naturally. Actually, you want to make use of the gravity, okay, to help the placenta descend, and with application of maternal effort. So the position that is advised to use for passive delivery of the placenta is the kneeling position. Okay, well, this woman has to be in the kneeling position. Okay, so we've talked about positioning. After positioning, you may talk about prevention of hypothermia. You know, at this stage, the woman usually feels cold and they may even start shivering. So you have to make sure that you provide extra linen and let the woman to keep the woman warm and prevent this hypothermia from escalating. Okay, so provide extra linen and to make sure that the woman does not go into severe hypothermia. Okay, then you may also talk about the active delivery of the placenta now at this stage. Okay, under active delivery of the placenta, you have to start from the point where you're giving oxytocin. So you may write the following points under active delivery of the placenta. Okay, you have to begin from the giving of oxytocin. You may say, I will give 10 international units of oxytocin intramuscularly within 1 minute of the baby's delivery. Then I will place a sterile receiver under the vulva of the mother when she is in the dorsal position. This is to receive the blood that is coming out of the vagina. Okay, and to make sure that when the placenta comes out, it does not fall on the linen, it goes into the receiver. Okay, then I will empty the bladder if it was not already done. I will empty the bladder at this stage. Then I will clamp the cord near the vulva with an artery forceps. Okay, with my right hand I will grasp the forceps and the cord. Then I will wait for the uterus to contract. Okay, then I will place the other hand, which is the non-dominant hand, the left hand, above the level of the symphysis pubis, with the palm facing up, with the palm facing towards the mother's umbilicus, and gently apply pressure to the uterus in an upward and backward direction. Okay, then at the same time I will firmly apply traction to the cord in a downward direction using the hand that is grasping the forceps. So I will apply steady tension by pulling the cord firmly and maintaining upward pressure of the uterus. Okay, and if the maneuver is not immediately successful, I will stop pulling and wait for the next contraction and repeat the process. Then, when the placenta appears at the vulva, I will grasp it with both hands and rotate it in order to rope the membranes. This may assist the complete delivery of the membranes. If the membranes do not advance, it can be delivered with gentle upward and downward motion. Okay. Once the placenta and membranes are delivered, I will massage the uterus in order to rub up a contraction and expel any blood clots. Then I will make sure the uterus is well contracted, and I will remove the placenta membranes and clots in a receiver. Okay, we are still on the active management or active delivery of the placenta. Okay, so that is about the active delivery of the placenta. Then you have to control bleeding after you have delivered. Okay, now how are we going to control this bleeding? You have to make sure that you do a quick examination of this woman and just see whether there are any lacerations that may need suturing. Okay, if nothing, then you just have to rub up the contraction and expel any clots from the uterus. Okay, then you control the bleeding. Then you have to carry out a quick placenta examination. At this point, you examine both the fetal side and the maternal side of the placenta to see whether it's a normal placenta and there are no retained products of the placenta. Okay. Then after you do placenta examination, you need to do the care after delivery. This is where you talk about you cleaning and drying the buttocks, remove the wet linen and secure the perineal pad, and change the linen, leave the patient clean, warm and comfortable. Okay, then I will give a warm drink if necessary and some analgesia to relieve the after pains. Then I will take the vital signs examinations immediately and you are done with your essay. Okay, I think if you wrote your essay like that, any examiner, any marker may not find a reason to fail you, because you will have covered almost everything that you need to talk about under the third stage of labor. I may have left out a few points, but you need to add in more flesh. Okay, thank you so much for listening. I hope this helps out as a guide to your management of the third stage of labor. Thank you.